A very good evening, everyone. Today we have Vaishali Rai, a theatre and a voice-over artist, an actor and event host. She will be the anchor for this program, asking the right questions to the health experts. Let's welcome Vaishali Rai, anchor Wellness Wednesday.
A very good evening, everyone. Namaste and Mabuhay. It is time for another health awareness topic on Wellness Wednesday. Today, being International Women's Day, this topic is dedicated to all women globally and is about a very common issue faced by many women today: polycystic ovarian disease. We have with us two experts today to address and discuss this issue. This Wellness Wednesday program is brought to you by Ivy, a not for profit organization, a platform dedicated to women in enterprise in the Philippines. According to National Library of Medicine, polycystic ovary syndrome, or PCOS, is not yet perceived as an important health problem in the world. It affects 4% to 20% of women of reproductive age worldwide. What exactly is PCOS or PCOD? How does it affect infertility in a woman? Can it be treated? These are various doubts that a lot of women who go through this face. To talk to us more on this, we have experts, Dr. Roli Sharan and Dr. Anuja Agashe. Dr. Roli Sharan is an obstetrician and gynecologist based in Rajkot, India, with expertise in infertility and aesthetic gynecology. For the last 17 years, Dr. Roli, along with her pediatrician husband, have provided comprehensive and compassionate care to their patients in their well-equipped Siddhi Vinayak Hospital in Rajkot. Dr. Roli is committed to staying up to date with the latest advancements in the field and delivering the highest quality of care to her patients. Dr. Anuja Abhijit Agashe is MS DNB in obstetrics and gynecology and is also a gold medalist from the University of Pune. She has worked as a lecturer in Pravara Medical College and BJ Medical College. Since 2010, she has been practicing in Pune at Agashe Clinic, Shashwat Hospital, and Krishna Hospital. She holds special interests in critical obstetric care and infertility. So I call upon Dr. Roli and Dr. Anuja. Dr. Roli and Dr. Anuja, thank you so much for being here on Ivy's Wellness Wednesday. We are very eager to understand from experts like both of you more about this disease called polycystic ovarian syndrome and disorder, which seems to be very common these days. Dr. Anuja, 20% of women are affected by it worldwide, but it is still not perceived as an important health problem. Is that true? And what are your thoughts on that, Dr. Anuja?
Definitely. Polycystic ovarian syndrome has a large burden on our society, and it is a problem that we are facing in almost all countries. It's not specific to any region or any continent, but it is present worldwide. But it is not given its due importance compared to the burden that it is putting on the society. Probably it's because of the lack of awareness amongst people about it. Then the people are not aware about its possible complications that it can hold in even later life. And the disease per se is not viewed in its entire spectrum. And that's why, as because it does not cause any immediate medical emergencies, it does not get its fair share of attention, I would say. But it's very important that we have to understand this disease to know and prevent its life-threatening complications which can occur in later life, I think.
Right. Thank you. Thank you so much for that. And that's exactly why we are here today, is to spread awareness about this disease. Dr. Roli, may I ask you, what is normal menstruation? What is the normal menstruation pattern? At what age does it occur?
Yeah, the normal menstrual cycle usually lasts between 21 and 35 days. Like average of 28 days plus minus 7 days is the normal length of the cycle. And it usually lasts from 2 to 7 days. It can be up to 3 to 5 days normally, but 2 to 7 days is also normal. The menstrual flow is usually moderate with about total blood loss of 30 to 80 ml. So that can be said around 3 to 5 pads per day. and the color of the blood is usually bright red, and there may be presence of few clots and a little bit of pain, and um, some cycles can be heavier or some can be lighter. A woman can have variation in cycle in the same in the same periods. She can have few cycles which are heavier, few can be lighter. So
Right.
this is all normal
Okay.
menstruation.
And has there been a change in the menstruation pattern in today's young girls?
Yeah, definitely there are lots of changes seen these days in the current generation. In the young girls, the extent and cause of these changes are still being studied, but we are seeing changes in the length of the cycle, the amount of blood flow. It can be scanty, it can be as less than 20 ml, or the cycle length is usually sometimes more than 35 days, more than even 40 days. There are features of uh, amenorrhea, oligomenorrhea, all these are seen in the present generation. So
And Dr.
maybe
Rowley,
these causes, yes, causes
sorry,
could be because of the diet and the lifestyle and presence of certain chemicals in the environment and chronic stress. These things are causing change. These changes are seen across the countries in different races and differs from uh, uh, a different differs from what can we say, person to person.
right,
Okay.
right.
I,
Okay, great. Thank you. Thank you for that, Dr. Rowley. Dr. Anuja, do you have anything to add on to that? As to do you see a difference in young girls having their menstruation pattern?
Yes, there is a declining age of, you can say, menarche, that is the start of periods, which is very noticeably seen. And almost it is coming down, you can say, every decade by 6 months to 1 year. And this is a big change, and that's why we see nowadays many girls at the age of 10 or even sometimes even earlier than that who have come up saying that, they are in a panic situation that, okay, my periods have started and they don't know how to handle it. So we have to understand the reason that why this is happening. A major part of it we can give about it is that it's because of the increasing weight. Obesity is a prime factor, plus the affluence of life, the sedentary lifestyle. And usually you will see that in obese upper class girls, who are having an affluent life and who are not exposed much to sunlight, not doing physical activity, eating a lot of junk food. So that is a very important factor which we have to take into consideration to bring about a control over this. Of course, the evolutionary process which is going on, that is also a role to play in it, which we cannot change. But whatever we can do about the factors that which we can control, we can definitely do something about it. Also, the use of a lot of hormonal injections that has been given to the milk, to the cows or the dairies that which we get, or the eggs, they are being injected with a lot of hormones. Maybe there are theories that even that is a possible cause of these hormones getting ingested through our diet, and that can also bring about a little bit of change.
Okay, thank you. Thank you, Dr. Anuja. Dr. Anuja, my next question really is on the topic that we are talking about today, which is PCOS. So, what exactly is PCOS and PCOD? Are they two different things or are they the same?
PCOD is stands for polycystic ovarian disease. Now, where does this name come from? So, in 1935, there were two scientists called Steen and Leventhal, and they observed that in young girls who were quite obese and they were missing their periods, that is called as amenorrhea, missing, skipping of periods. So, a triad of missing periods with obesity, and then they found that they had big cysts in their ovaries. So, they put this three together and they thought that this problem was because of the disease of the ovary. That's why the term polycystic ovarian disease came. And then they did some few procedures like wedge resections for it, and they found that the women started ovulating after that and they were conceiving or getting their periods. But later on, a lot of research went to it, and in 1990 and then later in 2003, this was renamed as polycystic ovarian syndrome because it is just not limited to the disease of the ovary, but it has got wide repercussions over the other systems of the body also. And then they found out that the major causes involved were hyperandrogenia, that is the increase in the male hormone, that is a testosterone hormone. Okay. Then hyperinsulinemia, that is they have a resistance to the insulin, and that's why the levels of insulin in their bodies were high. And also they had this polymorphology, the ovaries had big cysts. So all together they said that there was a syndromic approach, and then it was renamed as polycystic ovarian syndrome. So then, though even the name is suggesting more towards the ovaries, it is not just to do with the ovaries, but it is about a lot of hormones that are playing in your body, affecting a lot many systems.
Right, right. Thank you for that. Dr. Rowley, in your clinic, do you see a specific age group that is affected by PCOS? So we can safely now call it PCOS, right?
Yeah. The adolescents around 12 to 18 years, the reproductive age group that is from 15 to 45 years are affected by PCOD. And in adolescent age, like 12 to 18 years, there are irregular periods, like less than 9 menstrual cycles per year. And cycles which are longer than 35 days are seen. Signs of androgen excess, that is acne, hirsutism, and obesity, male pattern baldness, thinning of hair on the scalp is seen. Elevated levels of hormones and androgens can be
Right.
seen on the blood test.
Right.
And whereas in reproductive age group, that is in women from around 18 to 45 years, we are seeing again irregular periods and absent periods, that is oligomenorrhea, or absent periods, that is amenorrhea. Signs of androgen excess again are also seen in the reproductive age group, that is acne, hirsutism, or male pattern baldness.
Right.
And now we are more, we can say the ovaries are polycystic in ultrasound. That is after that, in this age group, it is more important to see the ovaries in this age than in adolescent, because then the cycle have just started. So elevated levels of androgens and other hormones are also seen on the blood test. And
Right.
for the women that is around the age of 45 and older, we see the complications and changes in androgens and hormones. Other metabolic disorders have set in, so lots of other changes are seen in the body because of that.
So, Dr. Rowley, what are the causes of PCOS? Is it hereditary, or are there any other causes?
Actually, the exact cause of polycystic ovarian syndrome is still unknown, but it is believed that can be related to lots of factors. Yes, hereditary, because PCOD has been shown to run in families where there are genetic component to the condition, and the mother to daughter or the siblings from the same family have PCOD features. But so there are again hormonal imbalances which cause PCOD, excess of androgens which interfere with the ovulation and then development of follicles in the ovary. That thing. And another cause is insulin resistance. That women in PCOS have insulin resistance, and which causes again hyperinsulinemia, that is increased level of insulin in the blood, and this leads to increase in the androgen production from the ovaries, and there is disrupted ovulation.
Okay.
Another cause is chronic inflammation, oxidative stress, and even inflammation, chronic inflammation to the gut is also one feature which is showing that it can cause PCOD in long term.
Okay.
Inflammation of gut by different glutens and other products, and intake of more sugary food, high sugar diet, which causes chronic inflammation to the gut. And then environmental factors also, like presence of certain chemicals or toxins, which are present in the household objects and the plastic use of plastic. So these products use cause they work as endocrine disruptors, and they cause hormonal imbalance, and they contribute to the development of PCOD in the women.
Okay.
So the exact cause is not well understood, but a combination of factors contributes to, yes, and we can say that genetic predisposition in a person, along with presence of these factors like improper lifestyle and environmental
Right.
toxins,
That's exactly what Dr. Anuja had also mentioned, the same thing. Right. Dr. Anuja, the next question is for you. What are the signs and symptoms of PCOD in young girls?
In young girls, typically with signs and symptoms, if they come to our clinic, it's the commonest symptoms and signs they will talk about is acne, because that is the thing that they are worried about the most, because it's most important to them at that stage of life.
True.
And the second most important thing is they'll talk about hirsutism, that is excessive facial hair growth, right? Because herein there is a male androgen hormone is in a little excess. That's why they have typically the male type pattern of hair growth. That's why, if we typically ask the girls that do you require to do a lot of threading, waxing, or, some treatments for your facial hair, then usually we'll get a response, yes, that is their most imminent problem. Plus, there will be a lot of hair on the midriff that will be there. And some women who have really high levels of testosterone may also come with baldness, the male pattern of baldness. Um, then after that, we will have excessive androgen, the hoarseness of voice or deepening of voice, especially in young pubertal girls, because the testosterone hormone is playing in here. So they are getting the, minute changes of male type growing. And some extreme cases, we also might get clitoromegaly, which is, a little the private parts, the clitoris is a part which is in place of penis in females. So, which is very small otherwise, but because of the excess testosterone hormone, it might grow a little bit. And that is called as clitoromegaly. So, the features of hyperandrogen are typically these: the male type of baldness, the facial hair growth, acne, and clitoromegaly. Then also they will come with complaints of irregular cycles, which is the most common. So irregular cycles, the definition is that the periods have to be somewhere, either they could be irregular, it means they get their periods on their own, but they are not sure, it will not be very timely. So it could be varying anyway between 35 days to 60 days. And in extreme cases, it will be like amenorrhea, that they're not getting periods for 6 months or more than that. So that is the common problem in young girls. So that is around puberty and pubertal girls. A little elder to that will come with the problems of infertility, that is inability to conceive. So that is the common signs and symptoms with which young girls will come. Okay, the symptoms will vary in a little adult females, right? So if we go to that section, it will be a different set of signs altogether.
Right. Okay. But these are the basic signs and symptoms that they will come across. So definitely, women. Is it different for adult women and elderly women as such? Are the signs and symptoms different?
Yes, in adult women now they are not so much concerned with this changes of, the acne will settle down, the, facial, they'll have treatment, they have gone through fertility treatments and that part is over. So, that they are not much concerned about that part of the symptoms. But then usually with the age, obesity sets in, that's the biggest cause. They will come with thyroid disorders, they will start complaining of. And with obesity comes an array of problems, because obesity, you can know, is a root cause of so many things. So they also will come with the presence of, insulin resistance, which is a common feature in PCOS. The signs of which can be picked up, but typically they will come with signs of, blackening around the neck or the armpits, or, soft skin tags starts developing around the neck. So that is called as acanthosis nigricans, which is a typical sign of insulin resistance. So many young PCOS girls or young females with typical blackening around neck and skin tags, then weight gain, then irregular periods. And also in these women now we can find irregular bleeding. The bleeding pattern may also get changed. They will come with heavy bleeding, heavy menstrual bleeding. Because what happens in PCOS is the ovulation is not occurring properly. That's why the lining of the uterus, that is the endometrium, is under the influence of only one kind of female hormone, that is the estrogen. The second hormone, which is balancing that estrogen, that progesterone, is not coming. That's why under this only influence of one hormone of estrogen, the endometrial lining starts building up. And that's why for a long period, for 3 to 4 months, it's just building, building, it's not shedding. That's why when they get the periods, there will be a very heavy flow. That is called as endometrial hyperplasia. This also makes them prone or a high risk for getting endometrial cancers later on if not treated. So in adult women, these are the main symptoms that we will see of insulin resistance, of obesity, thyroid, and endometrial abnormal bleeding.
Okay.
That will be the main focus of science.
All right. Thank you. Thank you, Dr. Anuja. Dr. Roli, do you think elderly women show other sets of signs and symptoms if they have PCOS?
Uh,
Like really older women, if they have PCOS, do they show different signs and symptoms?
yeah, older women have different signs of symptoms because they are suffering from the abnormal hormone levels and
Right.
from quite a long time. So they are they are showing disturbance in the lipid profile. They are showing type 2 diabetes features, and they are having obesity, more of obesity, central obesity than maybe in younger age group. It may not be so pronounced. And then endometrial hyperplasia is seen in older women more because whatever madam has said, from for a long period there is a estrogen effect on the ovaries. When so the size of the ovaries are also big, more than 10 ml, 10 more than 10 centimeters, and the size of ovaries are increased. The presence of cysts from such a long time is typically having typical features of pearl string appearance have been more in older women because they are suffering from these from a quite a long time from the same problem. So, and we are seeing the complications of the PCOD from such a long period what they have suffered. We see they are more prone for heart hypertension. They are having coronary artery diseases, more prone for stroke. So we have when we see the clinical and biochemical test, we are seeing the features of more of these hormonal imbalance and androgen excess in this.
So it can affect the heart as well.
Yeah, it affects the heart. It affects the whole system because it is a
Yes,
because
it's so much all the hormones and
yeah, we are seeing lots of complications. Cardiovascular system.
Dr. Roy, how do you diagnose PCOS for different age groups? Let's start with young girls. How do you diagnose PCOS for young girls?
In one second. Yes. Yeah. Yes. Can you repeat the question one sec?
How do you diagnose PCOS for different age groups? So if we can start with how do you diagnose it in young girls?
In adolescents, like that is girls of around 12 to 18 years age, we see irregular period, that is again less than 9 menstrual cycles per year, or cycles which are longer than 35 days. And signs of androgen excess such as acne, hirsutism, and male pattern baldness, thinning of hair, and as ma'am has said, nigricans, that is black patches on the body,
right,
on the skin. Then elevated levels of androgen or other hormones on blood tests can be seen.
Okay.
Whereas in reproductive age group, that is in between women of 18 to 45 years of age, we are seeing irregular periods or absent periods. Like there may be oligomenorrhea or amenorrhea.
Right.
The signs of androgen excess in such women like acne, hirsutism, and male pattern baldness is seen. And ultrasound shows the presence of multiple small follicles in the ovaries, immature follicles between 2 to 9 millimeter size, and more than 20 follicles in either ovaries can be seen.
Okay, okay. Okay.
In postmenopausal women, like again 45 years and older, we are seeing elevated levels of androgen and other hormone tests, blood tests. So not all women exhibit all the symptoms. Some women may have some other health conditions, and we have to do a differential diagnosis at this stage to rule out other disorders like
Okay.
Cushing syndrome and adrenal tumors. So some diseases have the same features, so we have to do the differential diagnosis with the help of our clinical and biochemical tests.
Okay, thank you. Dr. Anuja, would you like to add something to that? How would you diagnose PCOS in different age groups other than the Dr. Rowley did mention about the scan, but are there any other tests that
Typically, in young girls, we have a classification called as the Rotterdam's classification. So there are three major criteria which are told in that. The presence of hyperandrogenic features, as we said about facial hair, acne, and hirsutism. And then either it may be only clinical or also there will be elevated blood levels of testosterone. So that is one feature. Either of them is enough for diagnosis. Second is the oligomenorrhea or amenorrhea, that is irregular history of irregular periods or amenorrhea for more than 6 months. And the third classification is on an ultrasound presence of multiple follicles, that is more than 12 follicles in either of the ovary, measuring 2 to 9 millimeters. So the volume of the ovary should be more than 10 ml. So it has to fit into these criteria. So any presence of any two out of these is enough for diagnosis of PCOS in young girls. Once you have ruled out, as Dr. Rowley has mentioned, other causes of hyperandrogenic, which are rare causes of Cushing's or adrenal hyperplasia or adrenal tumors. So once we have ruled them out, presence of any two of this criteria amongst the three is enough for the diagnosis of PCOS. Then we can have, now PCOS is not a simple disease like you have diagnosed malaria, you give treatment and that's about it. It's a spectrum, and every girl will be at a different level on that spectrum. Like some girls will have minor affection, some will have medium kind of affection, and some will have a severe affection. So now, where is this particular patient we are going to place her on this spectrum? We will decide on further investigations by doing an ultrasound scan, then by doing a further blood test, hormonal profile. Majorly, we do the follicle stimulating hormone, that is the FSH, and the luteinizing hormone LH. Typically, we will find a reversal, that is the LH will be more than the FSH. Ideally, it should be the other way around. The FSH should be less than LH. So if we find the LH more than FSH, it is typically pointing towards PCO. So this test plus the serum AMH levels, that is the anti-Mullerian hormone levels, the elevated levels of these will also give us an indication that she is having PCOS. And then this is the typical investigations which we will do for a young girl. For an adult women, apart from this, she has been usually been diagnosed up till now that she is having PCOS. So what we are more interested now is to look whether is she going towards the other complications of PCOS. So I will look for her sugar levels, that is her fasting and PP and HbA1c levels, or do a glucose tolerance test in her to see whether her glucose tolerance is impaired, because she's a likely candidate to have type 2 diabetes later on because she's having PCOS. Then I will monitor her blood pressure because these are the ones who will have early onset hypertension or blood test. So my investigations in an adult woman will be more focused to see, I will do her lipid profile to see how her lipids are doing, because typically in a PCOS, we will have high levels of cholesterol, high levels of LDL, of triglycerides, and we will have low levels of HDL. HDL is the good cholesterol, which we want. So typically that will be dropped. So her lipid profile will be deranged, her sugars will be elevated, her blood pressure will be high, her uterus will be screened for endometrial hyperplasia, as I had talked about, because there will be thickening of the endometrial lining. So, if she is obese, I will also investigate for thyroid, because typically there is obesity in PCOS and truncal, and sometimes patients present with sleep apnea. That is a common complication. Because of the obesity and especially the truncal obesity, that is something called as a Pickwickian syndrome, in which, because in a lying down posture, your air passage gets blocked and there is a difficulty in respiration. So the patients do not realize, but there are apnea. Apnea means your breathing halts in between during your sleep. And this is a very, very common cause of oxygen deprivation and later on cardiovascular effects that happens on the body. So these are the contributing factors. So the base lies there because you are more prone for obesity, you are more prone for diabetes, hypertension all together. You are more for myocardial infarcts or hypertension serious or any severe complications because of that. So my investigations in an adult person will be more targeted towards, ruling out the complications because of the spectrum and to keep a check and a regular monitor on that.
Okay, thank you. Who knew that cysts on your ovary can really complicate matters in your body? So
As I
mother,
said, that it is
yes,
not just the ovarian problem, it is a metabolic problem affecting many systems.
right, right. So mothers and ladies out there, please take note of these various symptoms. If you see this happening on yourself or on your daughters, you know what to do. It is best to take them to the gynecologist and get them treated. Dr. Rowley, are there any more things that you would like to add to what kind of complications does one go through if uh, she has PCOS? Are they different for different age groups? Is there anything else you'd like to add to that?
No, I think Dr. has quite well told about all the complications, sleep apnea, and then yeah, cardiovascular disorders with certain stroke. I think stroke is also one of the complications of PCOD, and infertility. I think is also there, which I think we have not spoken about. So complications during pregnancy, I would like to say, we are seeing PCOD women in our clinic every day who have, by chance, they have conceived with drugs or sometimes just by luck, they are pregnant, but then starts the complications of pregnancy. We see lots of miscarriages, we see lots of complications of hypertension and GDM, that is gestational diabetes mellitus in pregnancy, and small for date babies. So we are seeing the complications during pregnancy in PCOD women, and to deal with it and to deliver a healthy baby. The baby in PCOD woman has the environment where androgen is more in the body of the mother, and sometimes these babies are prone for PCOD. They may be having the genes and the environment in the mother's blood, especially during the early part of pregnancy. If they are exposed to more androgens, then the baby also, the uh, fetus will have PCOD in future. So this is one complication we can say, or this is the one.
You can call that hereditary as well, right?
Yeah. So one of the causes of hereditary PCOD we are seeing right from in the mother's womb, it starts in a PCOD woman. So sad to say, but PCOD really, it interferes so much with the pregnancy, and to have a safe motherhood in a PCOD woman is also an achievement we feel nowadays. Then cardiovascular disorders also set in this woman, and we have to be careful about it because it is always very serious. So it is a chronic disorder, but the complications are life-threatening. And of course, breast carcinoma, endometrial cancer, ovarian cancers are also more seen in PCOD women because of the hormonal imbalances. And other thing, mental changes also in PCOD women is there. That is in adolescent also, because going through the transitional phase, they are undergoing lots of stress and anxiety, and even in the menopausal age group where there is again a transition. So along with PCOD, these changes are seen quite marked, and lots of assurance, a lot of counseling, positive thinking is needed to.
That's true. That's true. So definitely, I think infertility, mental stress, these are very important aspects of PCOS is what I feel. and it is very important to address them as soon as you notice them. Which is why I said, especially to mothers out there and women out there, that the minute you find any of these symptoms happening on you different, you have to or you must take the effort and go and see your gynecologist.
True.
Dr. Loli, coming to treatment, what is the treatment for abnormal hair growth and acne in PCOS patients?
Yeah, the abnormal growth and the acne both are the symptoms of polycystic ovarian syndrome, and it is because of the increase in androgen levels, testosterone hormone. So we are having medicines which are aimed at decreasing the androgen level. That is anti-androgen medication for in case of hair reduction, we use spironolactone, which is a anti-androgen medication. Birth control pills also in younger girls. It helps to regulate the hormones. It reduces the androgen production, and so the hair growth is also reduced. But this takes quite a long time. So temporarily methods like topical creams containing eflornithine and hair removal methods girls can start with to boost up their their body image.
Okay. Yeah.
Girls are quite worried about their acne, and when they have more hair, then they can go for immediate for shaving or for using wax or depilatory creams. But then laser is also the recent science which is helping in
For the
reducing hair
yeah.
growth, and with and for a quite for few sessions, if it is taken, it's very, very effective, along with use of drugs, with medicines like anti-androgens, and then is lasers, which we are doing at our place. I started it for boosting the confidence in a woman. Every girl who gets up in the morning and sees her face, and an adolescent with hairs on her chin and lip is much, much worried. So we start and we get immediate results when we combine the lifestyle, the diet, the use of creams, certain regimes, and lasers. Even in case of acne, same thing, like the diet and the exercises, and then maintaining a proper face care regime, day and night creams, which contain retinoids, and salicylic face wash, and certain antibiotic creams also when the acne is very severe or it is having pustules. So all this reduces the acne in PCOD very fast, and then we use lasers also. We have pico lasers and other treatments where multiple sittings will decrease the acne, and even the scars can be removed. So we say, don't worry, your skin will be as good as Ferrari. Don't worry.
That is lovely. That is lovely.
They need that confidence. They're depressed. So
it's nice to know that these issues can be addressed and that will make a girl feel much better again. Dr. Anuja, would you like to add something?
Yes, definitely in PCOS, I would say that 50% of the treatment is by lifestyle modification, which includes of proper diet and exercise and proper habits. But these days, because of our erratic lifestyle, we face a lot of issues. So I always tell my patients that 50% is in your hands and 50% treatment is ours. So by that, like we do not have to remind ourselves that you have to eat every day, drink every day, sleep every day. So it's in the same way, you have to exercise for 40 minutes every day, come what may. You have to have a balanced nutrition. You have to reduce that extra weight. For that, we have to have a proper body mass index has to be jotted down. And then the women or the girl is advised that you have to come into your proper BMI has to be achieved. So because that gives a immediate boost to the treatment that we give. The response that the patient gives to the treatment if she is following a healthy lifestyle is immense. So 50% is a lifestyle modification. So cutting down on junk, following the food pyramid, wherein you all your cereals and fruits and vegetables and fibers and whole grains come on the bottom, and your fried items and fat foods and all the syrupy foods go on the top, which you're not supposed to eat.
Yeah.
So that has to be followed. Even your sleep cycle, if it is disturbed, plays a big important role in PCOS because your body has a rhythm in which it is functioning. So late night parties, or sometimes because of work they have to stay up late with the shift duties. Even those patients face a lot of problem in tackling PCOS. So if they can work about it, so it's an important part of treatment. Medicines, yes, it's one part, but exercise, proper nutrition, proper sleep, and stress management. Stress management goes a long way in management of PCOS. So I always advocate that every PCOS person should practice a little bit of meditation or yoga if possible, or not, if not, engage in some de-stressing activity of their choice. And family support, if you have to do all of this, is equally important, because without their support, managing your diet pattern regularly, making time for exercise, making time for sleeping on time, if everyone in the family is doing the exact opposite thing, is very difficult. So we also have to counsel the family members along with the patient that you have to be supportive if you have to see some success on this front.
True, true. And discipline is so important here, I guess, to change your lifestyle, which is the most difficult part.
It is the most, but it's the most useful part.
I agree. I agree. Dr. Anuja, can someone diagnosed with PCOS in their 40s can still prevent chronic complications by making a lifestyle change?
Yes, surely, because if they keep their weight in check, if they start exercising regularly, because this helps to bring down your insulin resistance, it helps to keep your type 2 diabetes from developing early, it helps to prevent hypertension from coming on earlier. So that definitely is going to help you. So whatever is the time, even at 40, it's not late. You should always start modifying your lifestyle, start exercising. It will definitely help to prevent complications, or at least put them at a bay. Or if you are going to get diabetes, say in the 45, you might push it down by 10 years. That's also quite good. So lifestyle modifications, even though if you start late, will definitely help you, and everyone should do it.
Okay. All right. Thank you. Thank you, Dr. Anuja. Dr. Roli, would you like to add something to the treatment of obesity in your PCOS patients?
Yeah, as Dr. Anuja has said, all these I mean lifestyle changes, that is active life and healthy diet, and I can add that 5 days of week if they are exercising at least up to 1 hour, and they can do any activity, not only exercise like dances, like sports, or cycling or swimming, or whatever they like, and they can eat food in moderation. They can, not that they cannot take their favorite food, but then they can take food in moderation and add more of protein, more protein, low carbohydrate, low sugar diet. So all these things will help in losing their weight and losing and decreasing the features of PCOD. Then medications like metformin, which is a insulin sensitizer. It helps in improving the insulin level in the blood and also the hyperglycemia. So the weight loss in such women with metformin is very fast. So they can take help of that, and other medicines like orlistat. Orlistat is also helps very helpful in obesity and PCOS women. So it can be taken, and they, in extreme cases, uh, they can do bariatric surgery. That is, if there is severe obesity which is not responding to any medicine, so it can be help can be taken off. So obesity takes several months to show noticeable improvement, and for long-term management, we should continue with sustained regular lifestyle and diet and exercise changes in our body.
Thank you. Thank you, Dr. Roli. Since infertility is the most common, or rather something that is you're most prone to if you have PCOS. So talking about infertility, Dr. Anuja, infertility is common in women who are suffering from this disease. So could you throw some light on how would you treat it? Dr. Roli did speak about it a while
Yes.
earlier, but I'd like to ask you as well if you'd like to add to it.
Infertility is a very common presentation of PCOS because the problem here actually is that the ovulation is not occurring. And ovulation is what we need for fertilization of the egg and pregnancy to occur. So we have to address it. So when a couple comes to us with the complaints of infertility, detailed history of the couple is, that will give away most of the times that whether is she suffering. If we take a proper menstrual history, that how her cycles have been coming, and then the next thing that what we do is we have to plot her height and weight and take out her BMI and look for if whether she's going into the overweight or obese category. So that will also give us an idea. Then the workup will include of the hormonal tests that we will do on the test which I had mentioned, that the follicle stimulating hormone, luteinizing hormone, thyroid stimulating hormone, prolactin levels, and her AMH levels. So that will give us an idea about how severe the problem is that in this particular case. So first thing that we tell our patients that if everything is okay and if we want ovulation to occur, she has to, and if she's on the overweight side, she needs to lose that 5 to 7% of weight shift, because unless and until she does that, we are not going to get a very good response to the treatment. So lifestyle modifications, exercise and diet does play a role in the treatment part of infertility as well, because the treatment drugs that which we are going to give will act when the optimal levels because of this are achieved, right? Then counseling is very important to infertile couples because they are, in the down of their morale. There is a lot of family pressure, there is a lot of stress, and that's why counseling is very important. That this can be treated, this can have a solution. There is nothing to be disheartened, and they just have to be a little patient and they have to follow whatever has been told to them very meticulously. So once we are through this parts of the treatment, then actually we have a few drugs called as clomiphene citrate or letrozole, which are ovulation inducing drugs, which makes the ovary form the egg and release the egg. So we put her on that treatment and we follow her up with how the egg is being formed, which is called as follicular monitoring. And if we get a success with that, it's okay. Otherwise, we do have some injections also in our armamentarium, which will help us to stimulate the ovaries to produce eggs. Uh, and likewise, then the ladder of the infertility treatment comes that first we start with timed intercourse, that the patient is just seeing that she's ovulating. If it doesn't work, then we do her intrauterine insemination, because we have to put some deadline to the treatment, because everybody wants results when they are looking for infertility. So till the time that baby is not in their hands, you say, we just wait, do this, keep on doing this, it doesn't work. So if 4 to 5 good cycles of the previous treatment are not working, then you can step them up to the next level of treatment. And the last level would be in vitro fertilization, that is the IVF treatment. So usually these PCOS patients have a lot of follicles, so they get a good yield of eggs. And because the fertilization is done outside in the lab, most of the patients do give good results also. So definitely PCOS is something which can be treated from the fertility point of view. There is nothing to get disheartened, because there is a lot of, even scare or of fear in people's mind before they even, getting married. Okay, she's having PCOS, so should I go ahead with this person? Because later on we'll face problems of conception. So we have to do counseling of them as well, that that's something is very common and very commonly treated with very good results. So PCOS can definitely be treated and infertility can be overcome and they can have their own babies. One strong message that we have to send across, that you don't have to be scared, that everything is not lost if you are suffering from PCOS.
That's lovely. Thank you. Thank you, Dr. Anuja. What I really like, a point, what you mentioned, was the counseling bit. I think that we overlook, and it is so important to not just for the woman who's going through it, but for the family as well, as to how to address it, how to treat them, and all is not lost. And it's nice that if it comes from the doctor itself, that it definitely gives hope, and I like that. Thank you, Dr. Rowley. Is PCOD completely curable?
Yeah, because the cause is not well known yet. so that disease not fully cured, but it can be managed with appropriate medical treatment and lifestyle changes. And the goal of treatment is to reduce the symptoms. It is tailored to the women's need, and the symptoms can be cured. And we can regulate the hormones with the help of hormone therapy. Can reduce the long-term health complications which are associated. We can and lifestyle changes, maintaining healthy weight, eating balanced diet, engaging in physical activity regularly. It helps in regulating the hormone, and the symptoms of PCOS are improved. Medications like oral contraceptives and metformin, all these which help in insulin sensitivity reduction, surgeries to remove the cyst or to treat the endometrial hyperplasia. And as ma'am said about ARTs, that is in vitro fertilization techniques to tackle with the issues of pregnancy, and all these will help in treating the symptoms, but there is no cure sadly for PCOS. It can be managed, and that can improve the chance of a woman bettering her life. So no need to worry. We can.
There is no need to worry.
No need to worry.
Yes, true. Thank you. Thank you. So, Dr. Anuja, you did speak a lot about discipline, change in lifestyle, food. We did have a question from someone who asked if nutritional therapy, as such, does it play a role in the overall management of PCOS in addition to your treatment? So, you've already mentioned it, but is there anything that you would like to add to it?
Definitely, nutritional therapy is very important, and especially for overweight girls or young girls who come to us with PCOS, we recommend that in the initial phase when they are looking at a weight loss, we do not recommend any crash diets, any extreme measures of going because you are going to bounce back and gain all the weight that you have lost. It's we have to go by sustainable methods which can be sustained later on also. And we do not want to ruin our overall health. So a balanced diet, so tailor made to the requirements of that particular person is very important in the initial phase when we are looking at weight loss, because we need to actually count your calorie deficit, that how much do you need to lose weight to the certain level, the desired level. So what we recommend in that is that from your entire diet that has been charted for you, less than 30% should come from fats, out of which also less than 10% should come from saturated fats, because that are the ones which is going to add a lot of excess weight. Plus, we will say that directly sugar is worst, because more than fats, that is going to add on a lot of weight. So processed foods and sugars are to be kept at bay or very minimalistic. And you definitely have to increase a lot of fibers, fruits, vegetables, whole grains, cereals in your diet. Along with it, you have to have a good amount of proteins in your diet. Usually, our diet lack in protein a lot, especially if you are a vegetarian. And even if you're a non-vegetarian, the way in which you eat is most of the times wrong, because at least in India, people will eat a lot of curry, leaving the pieces behind which contains all the protein. And they will have a lot of rice along with it, which is again more of carbs. So, protein containing diet. So, through your pulses, your paneer, your fish, your meat, egg, milk. So, you have to have a lot of these things in your diet and cut down on your carbs. But you do not have to eliminate completely any of the things, because your body does require a little bit amount of carbs, also your fats in a correct amount. So, you do need a guidance of a nutritionist to plan and chart your diet accordingly, which will fulfill all these requirements. Plus, most of the times in PCOS is also seen that many of these girls are young, deficient in vitamin D. So, checking the levels of vitamin D and correction of vitamin D deficiency, if it is present, also helps in managing the nutrition part of PCOS. So a planned, sustainable diet which is well monitored, because to keep the person going on, regular checks are also equally important. And as I had said earlier, also this can happen only if there is a family support, group support, from even from peers, friends, because if they keep on alluring you, okay, no, what happened one day, you can break your diet, nothing big deal about it, it is not going to work. So, at least in the initial phase of loss, you need support from your friends, family, peers, spouse, everyone. And then later on, that self motivation will come inside you to maintain and sustain that. So yes, having a multivitamin tablet daily, a vitamin D supplement regularly, and a balanced diet definitely plays a very important role in the management of PCOS.
Thank you. Thank you. So we just concluding this segment of question and answers before we go to the key points. Dr. Rowley, what is your advice to those women with PCOS who go through tremendous amount of stress? How must family members deal with this?
I would like to say that every third woman nowadays is a woman having some or the other features of PCOD and are going suffering with complications also. So you're not alone. We all are there with you. Even though we are doctors, many of us, because of our sedentary life, because of our lack of awareness in the early stages, are suffering. So take help of your mother, your family members, and lead a happy, healthy life. And for youngsters, they can join a support group. They can connect with people with PCOS to provide emotional support, and they should not have the feeling of isolation. For mental health care, they can take some help of professionals also if needed. So a lot of support and love with a healthy cooking, meal cooked in the family, simple meals cooked with proper care is enough, and talking openly about it, about their experiences. It's not a stigma, the stigma of infertility, the stigma of complications uh, it should not scare them. They should come forward, take the treatment, and their symptoms can be treated. And if they um, help others also along with their experiences, it is going to help. Oh, the problem is underdiagnosis, overdiagnosis at times, and sometimes um, uh, because of that problem with the diagnosis of disease in the early stages. We should not be in a hurry to say that she is having PCOD. We can start with her symptoms, and we can help a girl to have a healthy and productive life.
Thank you. Thank you, Dr. Rowley. Would you like to add anything to that, Dr. Anuja? Can we have some parting words from you?
Yes, very importantly, PCOS is a disease which sadly cannot be cured, but can definitely be managed, controlled, and you can lead a normal life by managing all the symptoms. A few key points that we have to take care is in young girls, we have to be really aggressive about the treatment about their acne and hirsutism because sometimes that gives them a very poor body image, low self-esteem, and depression because of it. So that has to be managed very diligently. Might as well also infertility cases because that also puts a lot of stress on them. So availing the correct treatment at the correct time, these problems can be definitely overcome, and you can lead a absolutely normal life is what I want to tell very loudly. And of course, this can be done with de-stressing activities, managing your stress levels by doing something hobby of your own to build up your own confidence. And tender loving care always works the best. That is what is expected out of the family and peers. And PCOS can be very well managed with proper lifestyle modification, diet, exercise, and medicines whenever required, depending upon the symptoms.
Correct.
Thank you. Thank you. That was really awesome. Thank you so much. Viewers, our experts have shared enough on the need for family members to be supportive in managing PCOS. Today being International Women's Day, please ensure women in your family are diagnosed at the right time and the condition is managed well. So that brings us to the end of our episode. And I would like to conclude with some key points, which is three main symptoms of PCOS are irregular periods. Three main symptoms for PCOS are irregular periods, increase in androgen or testosterone, and polycystic ovaries. Manage acne symptoms at a very early age. With lifestyle modification and recent advances in treatment, all the symptoms of PCOS like obesity, abnormal hair growth can be controlled. Stress management, proper sleep, exercise, and healthy diet play a very important role in managing PCOD. Women with PCOS are not infertile, they can get pregnant with the right treatment. Nutritional therapy and family support are important in managing PCOS. Dr. Rowley and Dr. Anuja, thank you so very much for your time and the knowledge that you have shared with us. So friends, polycystic ovary can be very stressful for a woman. Today's episode has been very informative and has equipped us to deal with the disorder in a better way. So do share this video of awareness and help us spread the word globally. This is our second last episode of season 1. We hope that these sessions have created a little bit of awareness and have been helpful to all of you. Watch the space for more details. Until then, eat well, take care, stay healthy, and most of all, and most importantly, spread awareness. Because a better I is a better we. This is your host, Vaishali Ray, signing off. Thank you very much. Good night. Namaste and Mabuhay.